And you have 5 minutes.
Thanks, Laska Hirlock, and I too want to welcome Minister Lynch back to the House this evening. I'm not going to reiterate a lot of what has been said. I think, Minister Lynch, you know that my feelings in this area, and I have some very strong feelings in the whole area. If I could just start by just saying that the debate this evening is on the House is on mental health and suicide. It's just, as soon as I saw it, I kind of said, why are we having a debate on mental health and suicide? When are we ever going to separate the two? There are people out there who have mental health issues, but who never contemplate suicide. And a lot of the people who commit suicide are people who do not have mental health issues. And I think that constantly we are banding mental health and suicide under the same umbrella. And to me, okay, where they interlink, like a lot of other things interlink, but they are not. They are two separate areas. And I would ask that the next time we go to have a debate like this, that we separate them. And let's have a good, full debate on suicide and suicide prevention, and a good, full debate on mental health issues. Because I think the two are, you know, let's just separate them. I'm going to where I welcome the commitments, and I welcome that the new strategic framework will be cross-departmental. I think that's vital. That was one of the things that I was going to say to you today. It has to be, as you said, it has to be across transport. I know that myself in the area where people in rural communities cannot get from A to B because they do not have the transport or the access to it. Likewise in education, and that's an area that I'm going to speak about as well, because I don't think anybody else has brought that up. And that's where we have facilities, and let's have a recovery approach rather than medicinal approach. It's been referred to already today, and we all know cases of where people, and I spoke about it before in a debate here in February, where a child with an intellectual disability with severe behavioural problems go to the doctor and you're handed medicine and you say, hold on a wee minute, I don't want medicine, I don't want to, and you're told it'll calm the person down. You kind of go, no, what about the therapy, what about that? That was last February and I raised it here, and Minister, I'm not taking it up on you, you can't chase absolutely everything, but since last February, and it wasn't the first time that I had raised it, I still have got nothing back on where that child psychiatrist is for County Louth. There is still none. For the last 2 years I've been raising it up. There is still none. And particularly as with this person, if you're in the age bracket between 16 and 18, and I've said it so many times before, and I don't want to sound like a broken record, but I mean, you get to 16, you're out of the paediatric services. Can't access the adult services until you're 18. CAMHS, and I know that was the response that I got from before when I had an adjournment debate on it, CAMHS will have now agreed that they'll see 17-year-olds. They won't see anybody with an intellectual disability, and I stand to be corrected on it, but from what I have tried, they can't. This person that came to me in that crisis situation, we're told, you will have to wait, it was sent off to Beaumont, to the only adult, to the adult services there, and it will be at least a year. Meanwhile, not only are they coping with somebody with a mental health issue, they're coping with somebody with a mental health issue and an intellectual disability. And that's one person. There are several other cases. I've gone to before, Minister, with the case of an adult child who is seriously behavioural problems, and where they're looking to need residential care. The parents are elderly, and nothing has changed in the last 2 years. So I am just asking, yes, we welcome the benefits, but let's you know, all the rest of it, but let's have value for money. Serious value for money is something that's gone. I'm going to fly through the things because I don't want to waste all my time, so I'm just going to touch on these things. I welcome the little things. I know it's a little thing, but I do welcome it. The only thing I would say is, on the website, Your Mental Health, and kind of in preparing for this, I was looking at it. When you look at the map, and it goes back to what other people have said. When you look at the map and you put in for services that are there, they're clustered. You know, have clustered the usual around the city. Look in some of the rural areas, and again, that's where the transport comes in, because there are no services in those areas. And they are the places, you know, mental health issues are big things, don't just happen in the big cities. Very often, they happen in the most rural places. Speaking with a couple of people who work in the area of mental health and counsellors in preparation for this debate, I said, you know, we say the same things every time we get up, or we're singing the same song, but I just wanted to have a look at it. And something that came up was very interesting to me, was the fact that two of the councillors individually came back and said to me, one of the big problems that they find, and I'm just marking this, is that the generic medicines that are now being prescribed, that separately they have been told by service users, I hate that term, but that they have been told that they're not having the same benefit of them as prescribed named medication. And it's just something I just thought was odd, coming from two separate people, coming from two separate areas, that they just found that they weren't as strong, or that the medication wasn't working. If you just indulge me for a minute or two.
I can't give you 2 minutes.
Well, okay, just one.
You've gone over 5, sorry.
The most effective deterrent to suicide is to remove the access to means. I think that's the one that's something that has come out very, very strongly as well. And if I could just talk about the ASSIST programme, over 30,000 people, as you said, took part in ASSIST training last year. And this is just speaking with somebody who works in this area. None of them are committed. They don't have to commit to work in the area of suicide. So you're looking at €300 per person to do this training. And we have no written, documented evidence that actually all of this training is helping to reduce suicide. So I think that's another area. I would love another 10 minutes, but anyway, thank you.
Sorry, Anna.